Hello, Dr. Hill and fellow classmates. My project incorporated all of the quality and safety education for nurses, or QSIN competencies. For this integrated practice project, I wanted to conduct an education piece that involved patients on my unit that suffer from congestive heart failure. The first QSIN competency for this project is teamwork and collaboration. I collaborated with my unit's advanced practice partner to discuss my intent and goals for this project. Secondly, I used evidence-based practice by performing a literature review to look at current practices and research. Evidence-based practice guided me in making decisions about what I would teach my patients. My teaching brochure, which involves informatics, was the tool I used to teach my patients. The next QSIN competency associated with this project would be in the area of quality improvement. My efforts with this project will hopefully improve quality of life for my patients with CHF and will reduce hospital readmissions for this diagnosis. This education also involved the QSIN competency of safety because there is a safe way to deal with and treat CHF. On a cardiac progressive unit, I see many issues with coronary artery disease, but the problems that is forever reoccurring is patients with congestive heart failure. Many times we see the same patients over and over again, so my hopes with this project were to possibly assist these patients with frequency of visits to the hospital. The course of my project was over 2 weeks and actually only involved 7 patients. Due to a shortage of time, I only involved patients that I knew I could spend about 3 days with. I created a brochure that focused on the main topics that evidence showed were the most important for them to learn in order to prevent exacerbation. On day 1, I performed the pretest with the patients and educated them with the brochure. On day 2, I did reinforced education and answered any questions. And then on day 3, I performed the post-test. As you can see, my brochure was simple and focused. I wanted the patients to know the importance of weighing themselves daily, taking their medication as directed, and following a low-sodium diet. In addition, I wanted them to understand the importance of calling their doctor if any problems occur. As you can see, my pre-test and post-test were simple, but asked questions that would provide evidence of their understanding of the material. Based on the pre-test answers, I knew the area that needed to be focused on with each of my patients. This is how I incorporated patient-centered care, because the plan of care was individualized to the patient and involved education that would be most beneficial to them. My goals with the project were met because a pretest demonstrated a lack of knowledge about the disease and ways to prevent exacerbation. The post-test showed that learning was evident by improved test scores. My pretest data shows an average test score of 66%. The post-test data shows an average test score of 92%. That is a 26% increase in scores after the education. This concludes my video, which also covers the QSIN competencies of informatics. Thank you for your time and good luck to everyone in their future career endeavors. Bye.